A catheterization laboratory may look like a scary place with a big name, but it's a common stop for patients entering the hospital with possible cardiovascular problems.
In the Cath Lab, what happens is patient will be brought into the Cath Lab such as this, and their heads will be up here near the imager and their feet down here.
In the Cath Lab, cardiologists use diagnostic imaging equipment to visualize the arteries and chambers of the heart.
There are two ways to do the cath. One is through the wrist and another one is through the groin.
During the procedure, the patient will be moderately sedated to help calm the nerves and ensure they can lay still for 45 to 90 minutes.
They will put a fine tubing in a way very similar to an IV, but the tubing is way longer because it has to be long enough to go all the way up your arms to your heart, or from the groins all the way up here to the heart, so that they can inject some contrast to it. And then with that, they can visualize the three coronary arteries in the heart and see if there is any blockage.
Dr. Chan says there are generally 4 outcomes from a cath procedure. The first, nothing is wrong.
Outcome number 2 is the patient does indeed has some blockage, and that can be fixed by a stent.
The third outcome is when a stent isn't an option and the patient will be referred to a cardiothoracic surgeon to see if they qualify for bypass surgery.
And the earlier we open a blockage blood vessel supplying the heart, the more recovery the heart can regain the functions. We can prevent loss of functions of the heart.
The fourth outcome, if a stent or bypass isn't an option, is medical management.
We give them the medicine that will help prevent further progressions of the disease.
Dr. Chan says health risks in the Cath Lab are minimal, with possibly some minor bleeding at the insertion site or a drop in blood pressure.
If this is an elective procedure, it's generally safer than someone comes in with a cardiac arrest or having an acute heart failure flown in from a rural area. So it's totally different. The risks are totally different.
At MercyOne Siouxland Medical Center, Copple reporting.